Okay, good morning or good afternoon, and we're here today to talk about a really serious matter, and that is the coronavirus, which now has already hit the U.S. with 3 confirmed cases, 1 in Illinois, 1 in Washington State, 1 in Orange County, California. But let me say, and here is the coronavirus. It's a very weird-looking thing. It doesn't look as evil as it is, I guess I would say. And this reason it's not pink, it's because they used a green dye to detect it. And it turned out yellow and pink, okay? But let me say today, we're not here to propel panic or stoke fear, but to rather keep a good, proactive effort by the CDC, the Center for Disease Control, from going on interrupted, or to make sure that they go forward. Because this virus may be new, but we have always worked long and hard to combat these types of things, whether it was Ebola or SARS or MERS. And we put in place some good language and money so that CDC can go after this virus and make sure it doesn't become a big problem in the United States, or at least do their best to make sure that doesn't happen. What CDC has to do is simply what HHS has to do, CDC's parent agency. HHS has to formally declare a public health emergency related to the coronavirus. And that will spring $75 million federal dollars to up to 85. Okay. So all CDC has to do is declare the coronavirus an emergency, and that will spring up to $85 million that's immediately available. It's already been appropriated so that CDC can do everything it can to prevent the spread. While the present risk is low, you can never be too careful when it comes to something as deadly and virulent as this virus. And as I said, the CDC is doing a good job. We don't have any complaints with them so far at being proactive and working round the clock to protect public health. But we want to make sure they can sustain this pace and have all the dollars they need should the outbreak get worse. And should the outbreak get worse, they're going to need immediate access to critical federal funds that at present they can't access because an emergency has not yet been declared. Now, the CDC the funds CDC needs are locked up, not nefariously, just bureaucratically. And we're here to say, use the key now and unlock the dollars. And the only way to do that is declare a public health emergency. So today I'm urging HHS, Health and Human Services, federal, to follow the CDC's proactive lead and declare a public formal health emergency for the coronavirus. And in doing so, it will unlock tens of millions of dollars for the CDC to access. Thus far, the CDC's work in tracing the virus has been critically important. But if things get worse, they're going to need access to the funds. And here's the good news. The millions the CDC will need already exists in an account I was just able to secure an increase in the appropriations for. It's called the Infectious Disease Rapid Response Reserve Fund. And as part of the recent budget deal, which passed in December, working with the House, member Nita Lowy, we pushed and got $85 million more in the account. That is money that CDC can use to combat the coronavirus. We simply want it unlocked. The CDC will want it unlocked. And it has full discretion to use that $85 million as it sees fit. It's not bureaucratically directed out of Washington. It's the kind of flexible funding they asked us for. We had heard actually about Ebola increasing in Africa. And so we went to CDC and said, what do you need? And they told us this is what they needed. But it can be used just as easily for coronavirus because it's just about infections that would create possible emergencies here in this country. What is it used for? Epidemiological activities like tracing, additional or enhanced screenings like at airports, education for state and local health departments so they can inform doctors about what to look for, public awareness campaigns, and increased staffing. So, the sole purpose today is get this emergency declaration out because a stitch in time saves 9. Ready for your questions. Oh, one other thing, because this has New York relevance. I can confirm today that there's a Stony Brook University professor visiting his family in Wuhan, China, and so far he's been unable to return to the U.S. as a result of China's lockdown. My office is working with the State Department and embassy officials to ensure this Stony Brook professor is in constant contact with U.S. officials, and we're all working to arrange a flight home for him ASAP. I can't say any more on that, but we'll give you an update as soon as we know more. Okay? Great.
Senator, we've seen public health emergencies declared for things like natural disasters, hurricanes, earthquakes, the opioid crisis. Do you feel like this is already on the same level as those things?
Well, let's hope it's not. We've only found 3 cases, but the virus is deadly, and it's the same kind of worry that we might have had with Ebola. And we did a very good job using this legislation to stop Ebola from spreading dramatically in the United States. The same thing can happen here. So could this become the kind of crisis on the level of what you're talking about? Yes, but we have the tools to do everything we can to prevent it, and that's why I'm here today. Yes.
Senator, just to be clear, you're not saying at this point the CDC has been hampered by not having access to the
No, but you never know. Tomorrow, if you found 20 cases, they'd need a lot more resources. So, no, CDC is doing a good job, but they should right away declare the emergency so they have these funds. Look, right now it's important to do education with the public, to do education with the doctors. Maybe you have to screen at a few more airports, and they need the money for that. Okay? Any other questions on this issue?
Should New Yorkers be worried?
We should all be worried, not just New Yorkers. It hasn't been found here, but the whole country should be worried. But we've had good experience in fighting these kinds of viruses before. Remember, we're now a global world, a global economy. And something that happens in Africa, or if it's Ebola or coronavirus in China, can quickly spread here because there's so much more travel. So we have to be all the more nimble, and this legislation allows CDC to do that. Wait, someone who hasn't asked first. I always try to share the wealth. Yes.
Can you tell us a little bit more about the professor?
That's all.
Mental status and
We think he's fine right now, but he wants to get out of there as quick as possible, and we want to get him out of there as quick as possible. Yes.
Just spoke with a doctor who said this is a particularly bad flu season as well, and they can't really differentiate the symptoms between common flu and coronavirus. He said some 40,000 people may die in the U.S. from the flu this year. Is that part of the perspective on this?
Well, you know, we've always taken action against the flu in terms of getting flu shots available. There's been a lot of publicity about flu shots and things like that. I think the flu shot this year is relatively high in its effectiveness. It usually depends on how many different versions of flu there are. And so we're already doing stuff on flu. Corona is more dangerous than flu. Hopefully it'll be less widespread than flu.